Hello family, welcome to another beautiful edition of Annie Author's channel. If today's your first day watching me, please hit the red button that says subscribe and you will be among the very first people that will be notified whenever I post something new. If you're a returning fan, family subscriber, thank you so much. I really appreciate you. Please do not forget to share, like, and comment on my videos. Yes, please sit back and let's talk about men's health. This is very important. So I'm gonna be zooming in on the prostate. Yes, how much do you know about your prostate? If you're a man watching me, how much do you know about your prostate? It's very important that you know so much about your prostate. That will help you take better care of your prostate. All right guys, let's sit back and watch. So what is prostate? Prostate is a gland that is located right below the bladder and is deep inside between the groin, around the base of the penis and the rectum. So the prostate grows in size according to the age of the guys, okay? So prostate in the first place is only found in men. Women don't have prostate, only the men has prostate. So the size begins from the walnut size all the way to ping pong ball size depending on the age of the man. So it keeps on growing as the age advances. So is prostate really important in the guy's system or in men? Is it really important? What's the purpose of the prostate? So the prostate supplies a part of the seminal fluid which mixes with the sperm from the testes, okay? So prostate is very important for reproduction, okay? So when this seminal fluid mixes with sperm, it helps the viability of the sperm and the movement of the sperm from the testes to the way it's supposed to be deposited during ejaculation. So again, prostate is very important in reproduction. So it helps the sperm to survive as well as transport the sperm faster during ejaculation, okay? So that's the main job of prostate. So how does a man know that his prostate have issues? What are the signs and symptoms of problematic prostate? Okay, so the man will have a painful or burning urination. You know, when the guy is peeing, it's painful for the urine to come out and there's a sensation of burning as well. So the guy feels like the bladder is full but he cannot pee it out, okay, because if the prostate has enlarged, it will press on the urethra, so it makes it a little harder for the pee to come out. Also, the man will be feeling the need to go and urinate, the urgency to urinate more often. But when he goes, it doesn't come. And also the stream of urination becomes weak, okay? If the guy used to point straight to heaven, now it's going down. So the man cannot maintain that stream anymore. The stream of urine coming out during when the guy is urinating becomes very weak. And also sometimes it dribbles, okay? It's not steady, it dribbles. So that's how you know you have problem. And also this urine, there might be blood in the guy's urine and you feel pain in the testicles, a lot of pain or swelling around the testicle. And also there's sometimes the guy might feel numbness in the pelvic area that runs down, okay, around the rectal area. The guys will feel some kind of pain or pressure there. And also the guy might also have loss of bladder or bowel control. Okay, so you see the guy dribbling, even when he doesn't want to pee, he will dribble. That means the guy will become wet, you know, even when he wasn't peeing, but it just comes out that way. So also some guys will experience weight loss and also loss of appetite. So again, when you have these symptoms, just know that there is problem. And also during ejaculation, the semen is smaller. Okay, it is smaller and also thicker than it should be because the prostate is not producing enough of that seminal fluid that mixes with sperm and makes it come out faster and bigger. So you look at your semen, it becomes smaller and thicker than normal, okay? So that's when you know there's problem with your prostate. And also at night, you see that this guy want to go use the restroom, just like frequent urination. This guy is waking up to go pee, but sometimes nothing comes out. Okay, so that's how you know there is problem with your prostate. So when that happens, go and see your doctor for a proper examination and checkup. There are so many risk factors to having prostate issues. Number one is aging. If you're at age 50 and above, the guy should be experiencing some of those signs and symptoms that I mentioned earlier. So if you're not experiencing it now, please look out for it and examine yourself properly. Then another one is family history. So prostate issue is hereditary. If your dad, your immediate uncles had it, look out for it. So at age 40, if your family has it, it's going to start earlier in people that has history of prostate in their family. Then another one is race. Yes, African American ancestry can also be a risk factor of having prostate issues. Yes, African Americans, black people of all countries, yes, have higher risk of developing prostate issues. Diabetes, heart diseases, other genetic factors, unhealthy diet, excessive body weight, lack of exercise, your height. So statistics shows that people that are really, really tall are at a higher risk of developing prostate issues. And also people, or some hormonal factors is also a risk factor, and also prostate inflammation. So if you keep having prostate inflammation back to back, it might predispose you to having prostate issues. So we have 4 different types of prostatitis. Okay, we have acute, chronic pelvic pain syndrome, CPPS, and also asymptomatic inflammatory prostatitis. So those are the 4 common prostatitis. Okay, so the second type of prostate problem is benign prostate hyperplasia, which is known as BPH in the short form. So this one is basically inevitable. So as age advances, the prostate gets bigger, so the prostate enlarges. Okay, so the most important thing now is for you to go and see your doctor. So this starts at age 50, mainly at age 50. So that's why it's very important that you have prostate examination yearly or at age 50. But if you do the first one and everything is fine, the doctor might schedule you every 2 years, unless you have a risk factor that you need to have annual examination. So what are the signs and symptoms of BPH? You have urgent urination, but you know, the urgency to go and urinate, when you go there, nothing comes out, and when it comes, it dribbles, is weak, and you don't feel like the bladder is totally empty. Okay, then another one is that you have unusual color and smell from your urine. Okay, and there is also painful urination and ejaculation. Yes, painful urination and ejaculation. So these are the signs and symptoms of BPH. What other problems are related to prostate issues? Problem having sex, SES, let me put it that way, and urinary tract infection, inflammation and pain around or near the prostate, bladder stones, kidney failure, sleep deprivation due to that nocturnal urgency. So at nighttime, you see the guy waking up to go pee more often than he normally does. So there's a problem with the prostate. But the worst thing about this is, like, this guy feels like urinating, but urine cannot come out, or it comes out just a little bit and the bladder is still full. Okay, so those are the problems related to prostate issues. So what are the diagnostic studies of the prostate? How can the doctor determine that you have prostate issue? How? Okay, so I'm gonna start from the simplest then we're going to escalate. Okay, so the main thing is to have physical exam, which includes digital rectal examination, checking for swelling, tenderness, and enlargement of the lymph nodes around the groin area, and possible leakage of fluid from the urethra. So this can start from 40, as I mentioned earlier, if you have family history. Otherwise, it starts at age 50. So please have your examination of your prostate, okay, at 50. If you're not at risk, it will be done every 2 years. If you're at risk, it will be done every year. All right. Urine test to look for blood and also lower urinary tract infection. Another thing is blood test for the prostate specific antigen, PSA level. So that one is very, very common. The doctor will just draw blood, and the normal level of the PSA is supposed to be 2.5 to 4 ng per ml. Okay, that's the normal range of the PSA. So if the doctor finds that you're within the normal range, the doctor might decide to be checking this every 2 years, unless you are at high risk. Otherwise, if you have anything, if your PSA level is greater than 4.0 ng per ml, it becomes suspicious. Okay, so this doctor at this time will go for further testing. The doctor will refer you to further testing. Okay, so another thing, if your PSA level is 10 ng per ml, there's a problem. Okay, so the doctor will be examining and thinking, this person has 50% chance of having prostate cancer if your PSA is 10 and above. Okay, so it becomes very, very worrisome. So the doctor will order more tests for confirmation. Okay, so another test that could be done is ultrasound, urodynamic test, cystoscopy, prostate biopsy. So it depends on what the results are. The doctor will escalate the diagnostic studies. Okay, so these are things that needs to be done to be able to determine the exact medical condition of your prostate. Okay, how are prostate problems treated? So we go with the treatment according to what is happening with that prostate. So like I mentioned earlier, if the patient has prostatitis, if it's chronic prostatitis, we focus more on pain control and bladder muscle relaxation with alpha blocker medicine such as Flomax, and also we encourage the patient to have warm baths or sit in warm water to relieve the pressure and pain around that prostate, groin, rectal areas. Okay, and we also encourage the patient to avoid stress. Okay, so relaxation techniques are very, very important. Then if the prostatitis is bacterial, yes, if it's bacterial, then the doctor will order something like antibiotics. Okay, and the patient also needs to increase oral fluid intake, especially during the daytime. Do not increase your oral intake during the evening or at night, because that's going to also push you further to be peeing all night long. And another thing, if the problem, your prostate problem is benign prostate hyperplasia, BPH, so the doctor will continue to do annual checkup of your prostate. Okay, so this is termed watchful waiting. Watchful waiting. So the doctor is going to be examining you on your annual visit, okay, to see how the condition of the prostate is, whether it has enlarged bigger or whatever medication that is giving you is helping you out. So the doctor will examine that and follow it up accordingly. Then another thing the doctor can ask you to do is to change your lifestyle. So if you have been living all this kind of lifestyle that doesn't support your health, you need to make some adjustments. Okay, so drink lots of water during the day and reduce towards the evening and night. Okay, avoid caffeine and alcohol. Yes, you got to avoid caffeine and alcohol if you have BPH. And also, if the doctor have ordered diuretics for you, that's the water pill, make sure you take it in the morning so that towards the evening you must have done peeing, okay, and you will be back to your routine peeing or urination instead of that frequency for being on water pill. Okay, You can also treat prostate issues with medications, okay? So these medications helps to stop or minimize the growth of the prostate, okay? So medications like Proscar, Avodat. Let me tell you one thing about Avodat though. So if your doctor have ordered Avodat for you, if you're a guy that is still having kids, be very, very careful. It's a very strong medication and very, very sensitive, okay? So make sure you keep it away from where other people can touch it. Your wife, your pregnant wife or about to get pregnant wife shouldn't touch it, okay? So this medication is that strong. Okay, so let's be careful, and also wear gloves or wash your hand immediately after messing with this medication. It's a very strong medication. All right, okay, so what does this medication do? It helps to maintain or control the growth of the prostate. Then another medication the doctor can put you on is the doxycycline. Okay, this medication helps to control the bladder muscles. Okay, so that's why the doctor will put you on it. It helps to relax the bladder and the prostate and the muscles around the prostate. Then another thing the doctor can do, depending on the condition of your prostate, is refer you to surgery. Okay, surgery can be done to remove the prostate depending on the condition of your prostate. So the doctor, if it's getting worse, the medications are not controlling it. Everything that is being asked for everything that is being done is not controlling it. So the doctor will seek the alternative of having surgery done. Okay, so the surgical removal of your prostate would then be the next option. When everything is done, that's the next option. So, but let me tell you this though. People that have had radical prostatectomy, that's removal of the prostate, 85% of these patients have erectile dysfunction. So this erectile dysfunction can be temporary, it can be permanent. We don't know. Okay, so that's the part you have to discuss with your doctor before you go to this surgery. Okay, and I believe every doctor should be able to tell the patient that there is 80% chance of a patient that have had radical prostatectomy to have erectile dysfunction, which could be permanent or just temporary. We need to be careful on that. Then another option is chemo. Yes, that's chemo. When everything else is done, even some doctor will combine surgery and chemo together to make sure everything is totally eradicated, especially when it's good. If the prostate, problem was heading towards being cancerous, so the doctor will combine these two treatments to make sure everything is totally taken care of. All right, guys, so how do we prevent having prostate problems, or how do we prolong having prostate problems? So I would say have annual prostate examination, please. Always have annual prostate examination. If you are 45 years of age and you have a family history of prostate issues, please make sure that you have annual exam. Otherwise, every man 50 and above should have annual prostate examination. Okay, then the next one is to treat lower urinary tract infection promptly. Okay, if you notice that your urine is smelling nasty and you're dribbling something that is not normal and there is swelling around that area, painful urination, painful ejaculation, if you have any of these symptoms, please see your doctor immediately. Okay, a stitch in time saves 9. If you have any of these symptoms, see your doctor immediately. There's nothing to shy about. It's better you be alive and healthy than the other way around. Okay, then another thing is diet. Eat at least 5 servings of fruits and vegetables. Eat healthy. Okay, you know, some of these fruits and vegetables has anti-inflammatory properties. So the more you eat them, the more they help you to fight all these small things, infections, bacterial, and all those things happening. So the more healthy you eat, the better. So again, choose whole grain bread over white bread. Then another thing, limit the consumption of processed meat. You know, this red meat, be careful. limit how you consume them. So it's not a matter of being available. No, your health matters a lot. So limit the amount of red meat consumption, okay? Then also you can increase something like fish. Salmon fish is good. And also another thing you can increase in your diet: tomatoes, avocado, bell peppers. Yes, those are very, very good for prostate health. Very, very good for prostate health. Again, salmon, fish, tomatoes, avocado, bell peppers, wheat, whole wheat. These are very, very good for your prostate health. And also pumpkin seeds. Pumpkin seeds are very, very good for your prostate health. Even melon seeds, those are very, very good for your prostate health. So increase those intake. Again, if you have other medical conditions that prohibits you from increasing those, you can also be very, very smart about it, okay? And above all, increase your water intake during the day and lower your water intake towards the evening and towards at night, okay? Because if you don't, that's going to make you to keep on waking up to go pee and nothing comes out, or you dribble and the bladder is not fully emptied and the problem continues. So that's why you need to taper down water intake as the day goes down, okay? Another thing is exercise. Yes, practice Kegel exercise. Google it, Kegel exercise. This will help you to control your bladder and also support your pelvic muscles, okay? Something like walking is good, jogging, swimming, and playing table tennis, lawn tennis. Those are good. Those are very, very beneficial for your prostate health, okay? Then another thing is your weight. Please maintain adequate body weight. If you need to lose weight, please do. If you need to control your weight with whatever diet and exercise, please do. So studies shows that men that are obese, okay, are at the higher risk of developing prostate problems faster than the rest of the people. So that's why you need to maintain adequate body weight. And above all, avoid stress. Stress is not good for your body. Stress can make diseases that are hiding in your body to come out faster or to take you down faster. So that's why you need to avoid stress or reduce your stress level. This will help you to live longer. Just on a general note, it will do that. So please, if you know anything that is causing you lots of stress, be careful and find a way to control that stress. Okay guys, so this is the much I have about prostate health, okay? So guys, do not forget to share, comment, and love my video. Give me thumb up, okay? So I hope we learn one or two things about your prostate, and please take good care of your health. It's very, very important. Health is wealth, okay? You cannot get wealth only if you don't have your health. So health is wealth. All right, thank you guys for listening. I love you guys. Bye guys. Bye. Love you.